We shall now take the questions. Please be reminded that we have set a time for ourselves. We have also agreed that we'll make the questions direct and we avoid double-barreled questions. Thank you.
Good afternoon, sir. My name is Juliana Taiwo Baloyen. I write for Sun newspaper. Minister of Health, Minister of State Labor, and probably the NLC president, since he's here. I got this from one of the resident doctors in Jos. He said 25 of them were recently sacked. 25 of them was recently sacked. And he's wondering why, in the midst of this pandemic, professionals that are more needed are being sacked. If you are not aware, now you are aware, are you going to act? The Minister of Health, someone wants to know if the policy of handing over the remains of COVID-19 victims to health authority still stands, or can family and friends now attend a COVID-19 victim burial publicly? SGF, sir, this is from another concerned citizen. She says she's complaining of harassment from AEDC officials threatening to disconnect her office electricity. She said they've been at home, they've been up to date with their bills, but somehow the NCDC is threatening, AEDC, is threatening to cut off their electricity supply. So want you to intervene and talk to them. I'm only a messenger, sir. That's basically it, sir. Thank you.
The Chairman, National Coordinator, Honorable Ministers, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually goes to the DG of the NCDC as well as the National Chairman. Yesterday, you confirmed that the lab in Kano is shut for the contamination and disinfection. I want to know how long will the decontamination and disinfection take? And are samples being taken from Kano to other states while this decontamination and disinfection is going on? Because I know in the last few days we haven't seen any confirmed cases in Kano, so I'd like to get an update on that. And the next question really is to the National Chairman of the PTF. Well, you have spoken several times about synergy all across the country to defeat COVID-19. But yesterday, the Governors Forum had a meeting, and one of their communique is the fact that they want a decentralized coordination to contain the virus. I want to know what this means really, because they are insisting their commissioners of health have to be in charge of their state-owned response. I want to know how this synergy will work with the national as we try to contain this virus. And the next question, adding to that, they said that they're not being carried along. That's the state task force. They said they're not being carried along. So I want to know the steps you have put in place really to carry the state along as we fight to contain COVID-19. And finally, the Minister of Health. Well, the SGF earlier on told us about an MOU that was signed for the frontline workers as it concerns their insurance. He says you are going to expatiate. I don't know why you skipped that in your opening address, so would like to get more details concerning that MOU that was signed. And finally, to the State Minister of Education, really. You have spoken about the online classes starting. I want to know, when are we looking at these classes starting and from what level? Is it going to cover the nursery, primary, secondary, and tertiary, or who are you targeting with the online classes that you have said that you're working on with the ministers, that's the state commissioners for health across the nation? Thank you.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My first question is to the representative WHO. Today is World Malaria Day. Madam, I would like to know what WHO will further do to help malaria, sir. What WHO will further do to help the Nigerian government to end malaria in our community. This to the NCDC. Sir, you just mentioned something about our older population, which is commendable. Since we have different strategies for testing and what we have, I would like to know what the PTF team will be putting in place in order for us to protect this group of persons to fight this pandemic. Thank you very much.
Good afternoon, all. My name is Helen Osamede Akins. I report for TVC News. My first question goes to the DG and CDC. Sir, there's a report that the detail of a girl who tested positive in Plateau has been everywhere, including her test results. Is it still ethical to violate the privacy creed of the medical practice? How do we differentiate between malaria symptoms and COVID-19 symptoms, considering the fact that we are gradually going into the rainy season, which gradually makes some people experience or develop symptoms that relate to that of COVID-19? My other question is this. On a daily basis, we record increments in the number of confirmed cases. Is there any projected time that we will get to start reducing the case? And lastly, thank God we have the NLC president here. With the lockdown and the livelihood, is it possible for us to have the PENCOM give at least 15% out of pension savings contribution with pension fund administrator to help Nigerians caution the impact of the lockdown in this period?
The Chairman, sir, members of the PTF. My name is Nancy Oyedia Orum from AIT. So my first question goes to the Director General of NCDC. So there was a case in Mabushi. We had that report yesterday on AIT that a community, about 500 persons were tested for COVID-19 and 40 persons came out positive. And some of the numbers these people gave and the addresses, they called people, some of them didn't pick up. And those that picked their phone number said they would not come for isolation because they haven't received palliatives from the federal government. So my question now is, so are there strategies on how to trace people aside just the manual? Because I've seen some countries that have come up with technologies on how to trace patients. My second question is to the Minister of Foreign Affairs. So there was a report from Punch yesterday that said about 72 Nigerians in China tested positive for COVID-19, and about 111 other Africans from the African continent also tested positive. And also a viral video where a Chinese national was asking another Nigerian based in China if it was true. But this guy, Blessing, I think his name is Blessing, debunked that fact. So I want to know the true state of that. Finally, sir, Mr. Chairman, please, I want to know the true state of the 500 billion naira intervention fund that was set up by President Muhammadu Buhari. Yesterday, the Chinese government donated about 48 million naira to the PTF. I don't know if that money is also going to that intervention fund. Thank you, sir.
Good afternoon, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Nazif. I work for Voice of Nigeria. A lot of effort have been made since the beginning of the fight against this pandemic. Not quite long, Dr. Aliyu made mention of the need for the state structures to liaise with the local government in order to have a robust effort in fighting this thing. So many centers, testing centers and isolation centers has been established at the state level headquarters. What about the local government areas? We have 774 local government, but we have not had isolation centers at the local government level and testing centers. If we have, maybe this thing should tell us, please. Thank you.
Good afternoon, sir. and my colleagues. My name is Abiodun Oloyipopola. I'm going to ask in English. I only one question, and I'm asking in English. And I always honorably ask as Minister of Health, State Minister of Health, Olorunbe Mamora, to please, sir, answer in Yoruba. We really appreciate. My question is a follow-up question about the Chinese experts. The Minister of State told us that they have been tested, and we have not heard anything about it since there before yesterday. We want to know, have they tested them again, and what is the outcome? Ìtumọ̀ ìbéèrè tí mo béèrè ní èdè Gẹ̀ẹ́sì ni wípé àwọn ará orílẹ̀-èdè China tí wọ́n ní akọ́ṣẹ́mọṣẹ́ tí a gbà lálejò lórílẹ̀-èdè Nàìjíríà, mínísítà fún ètò ìlera sọ fún wa wípé wọ́n fẹ́ ṣe ìdánwò míì fún wọn, fẹ́ yẹ̀ wọ́n wò lẹ́ẹ̀kan sí. A fẹ́ mọ̀ ṣé wọ́n ti yẹ̀ wọ́n wò àti pé kí ni àbájáde àwọn ọmọ orílẹ̀-èdè Nàìjíríà fẹ́ mọ̀. Thank you very much, sir.
Good afternoon, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like the NCDC boss to actually respond to my question. Since the beginning of this week, we've been repeatedly told that the laboratories we have are underutilized. A lot of persons are not coming out for testing. Now, my question is, why are we not introducing door-to-door collection of samples? Since we cannot do door-to-door testing, why are we not introducing door-to-door collection of samples, especially in those states that are burdened with this disease, so that we can scale up our testing? And there is a follow-up to yesterday's question that our Minister of Foreign Affairs responded to. Obviously, the person was listening to the program from UK, and he sent in a question. He said 2 letters were sent to them, those Nigerians who actually wanted to be evacuated. And 1 letter was sent on the 6th of April, which requested them to submit their data. And another one was sent on the 18th of April, informing them of their obligations. Part of the obligation is that they will pay their transport, and they also told them that they will have to submit themselves for testing when they arrive in Nigeria. They will be quarantined. Now, my question is this. Why are we not testing them in the UK? Why are we combining both those who may be having the virus and those who are free in this flight? We'll bring them here before we test them. And similarly, a similar distress call from China. They have been in quarantine for 3 weeks. They've exhausted their money because they are paying for their accommodation, their quarantine. And the Chinese government is saying that the delay is from the Nigerian government. What are we doing regarding them? Thank you.
Good afternoon, everyone. My name is Mitaire Ikben with the Nigerian Television Authority. Yesterday, the Minister of Health told us that more than 40 health workers have tested positive to coronavirus in the last 2 weeks. For me, this statistics is huge for frontliners with medical training, not to mention other frontliners without medical training like journalists, cleaners, and security personnel. So what is the plan of the government to mitigate the risk, the hazards, and the dangers posed to all frontliners in the COVID-19 fight? And we were just told now that 5,000 workers have full insurance cover. Are journalists involved in this? I want to also ask that we've not had patients. In the last few days, we've not had patients who have been discharged for coronavirus. Does it mean that the patients we have now are not responding to treatment? And a Nigerian just sent this now for the DG of the NCDC, that with 1.5% chance of coronavirus spread if everyone wears a mask, a face mask. Does this suggest that if everyone wears a face mask, the lockdown will be lifted? Thank you.